Hi, I'm Dr. Keshishian, and welcome to our podcast series, PPE, Podcast for Psychoeducation During the COVID-19 Pandemic. Today, we are discussing how has the healthcare system changed due to the pandemic, and how can we continue to improve together as a community. COVID has changed the way we practice medicine, and we are seeing other areas in society demanding change as well. For example, given the recent events, we are seeing calls for police reform, calls for reform in the criminal justice system, and calls for reform in the government. We as medical professionals have an obligation to serve as role models and examples to our community. As this is a time of change and reform, much of it necessitated by COVID, it's an opportunity for us to be better as well. I'm joined by Dr. Andy Lee, Director of Specialty Care and Clinical Innovations at LAC-USC. Hi, Dr. Lee.
Hi.
So we're going to talk a little bit and take a deeper dive into our county hospital system and how we serve the community. We'll discuss some of the ways we have adapted medical care during the pandemic, and we'll look at lessons we can take away from these experiences, which help us to continue to improve and advance. So Dr. Lee, as a leader in the county healthcare system, how would you describe our mission here?
So I believe one of the biggest foundations for how we build healthcare is that we understand there's a huge disparity in the way that we deliver care to the underserved. And really our mission is to disrupt that disparity and find better and innovative ways to provide better care for patients in our community who have difficulty accessing high quality care. One thing's clear, that COVID's here to stay, and all the information telling us is that this is going to be part of a new reality. And what I see coming in the future is that we're going to need to figure better ways to connect with our patients. That's going to be more than just face-to-face, and technology is going to be a big factor. In this situation with the county, we know the biggest barrier that's going to impede us from actually moving forward is we know that there's a digital divide. Though technology is really great, we can access people through our smartphones, our computer, our telephones. We know that in the safety net population, there's such disparity in the way they access technology. And that has not been paved very well. So one of the things that's really helped our efforts to democratize healthcare through technology has been a social movement to provide ubiquitous Wi-Fi or connection for patients, specifically for the kids and schooling. And what I see in the future is a more robust system at every home to access technology. And that's where we're going to be building most of our healthcare services. So that's the future that we're looking for. And this is something that I think the healthcare system have wanted for the last 10 years, given the COVID situation where infectious disease is such a big problem when you come in contact with healthcare providers as well as institutions like the hospital. This is a perfect time to really build out that digital reality.
That makes a lot of sense. And I think part of it is a new perspective and being open to the idea of change. For example, in patient care, there are pros and cons to video visits. One of the pros is I can see your natural home surrounding, which I would not have had a glimpse to in the past. It's really all about reframing and providing more access in different ways.
Yeah, I do agree. And I have to say, from a healthcare provider, as an endocrinologist, I know that I'm having tremendous challenges changing into this environment because I have a natural relationship with each patient visit when they're in an exam room, and I know that a lot of patients, despite having telephone visits, they have also said, I miss having that conversation with you in person.
Yeah. And so it's kind of compromise in between. Let's do the best we can with the technology we've got, but understand that we're all humans. We need to connect in some way, shape, or form a little bit more intimately, it sounds like.
Yeah. And kind of what you said, when the patient is actually at home, a lot of them appreciate that form of convenience. And because of that, we've been able to actually gather more information because they're at home. Mm-hmm. So I run a complex diabetes clinic, and through this pandemic, we have been able to direct all interventions to their home. So what we've done is we package all the medications so it's delivered to them on a regular basis. so they don't have to come to the hospital. Secondly, we know that there's food insecurity for many, so we work with a health plan to actually develop medically tailored meals so it can be served to the patients. And lastly, we just provide very focused education over the phone. And for quite a few patients, we've actually been able to dramatically reduce their blood sugars better than they were pre-COVID. So I do think there's opportunities for better healthcare, and it just requires for us to be open about the realities of the current system, but be transformed by all the obstacles.
So the takeaway is that we were forced to make these kinds of changes, but some of them were really positive, and we should hold on to them even after COVID.
Right, right, absolutely.
So where do you think the health community, we as doctors, with everything that's going on just around us socially, where do you think we as physicians stand in that, and how can we help better not only the healthcare system but our communities?
It's interesting you asked that question. I think it's a really appropriate question for the time. Many of my conversations with my patients specifically, they're looking for moral leaders during this chaos, and I think they trust their clinicians to really understand the realities not just of the healthcare system, but of the social unrest that's happening specifically in the safety net. Because as you know, when we treat patients in this community, uh, first and foremost, you have to have empathy, right? We don't treat patients just on their conditions. We generally have an understanding of the communities where they're coming from, as well as all their barriers, and that's how we establish our relationship. So with each encounter, they're looking for us to some guidance regarding how to deal with some of the um, social situations. And I had a patient talk about her history of police brutality. It was cathartic for her, but she needed that just so that she can have a better understanding of where she was at this period in time with all this what's going on with George Floyd and situations with the African American community before she can actually even talk about our healthcare system. So that's just to show that we providers and clinicians in the safety net, we have a unique position in really being the soul of the healthcare system. So patients look to us, they trust in our care, and they trust in our healthcare network. And that's a unique position we hold in the community.
Yes, you touched upon a few things. The first is the holistic and the complete approach to patient care, right? It's not just a lab report, it's not just a blood pressure, it's all of everything that's going on socially, mentally, physically, everything that's going on with the patient. And we in the healthcare system have a responsibility to address all of that and be there for our patients in that way. And that's the challenge that we all must rise to during this time. It's not just it's not social distancing, it's physical distancing. We need each other more than ever.
Yes, agreed. Absolutely.
You did say something very comforting, and that was that we're here and we're here to serve. And I very much appreciate you saying that, because at the end of the day, the reality is we don't know what's going to happen. And we're kind of taking this day by day. But knowing that there are people here to help you, that is a comfort.
Yes, absolutely.
So thank you for explaining a little bit about the healthcare system, discussing ways in which we have changed and tried to improve reaching out to our patients during this time, and the discussion that we're here even though we don't know what's coming for the future.
Yes. Thank you so much for having me.
Thank you.